This presentation is an educational training on the concept of just culture and how it applies at Memorial Hospital of Sweetwater County. At MHSC, we highly value our culture of safety, and we are always looking for ways to improve patient safety. Implementing a formalized just culture is one way we are progressing our patient safety culture. By the end of this presentation, the learner will understand the just culture concept, understand objectives of the just culture policy, understand the just culture algorithm, understand the purpose behind a just culture at MHSC, understand the differences in the three behaviors, understand why a just culture is important to patient and staff safety, understand how just culture applies to MHSC's mission, vision, and values, and understand how a just culture impacts staff members. Some background to Err is Human Building a Safer Health System was a groundbreaking 1999 report by the Institute of Medicine, which revealed that as many as 98,000 Americans die every year from preventable medical error in hospitals. This number stunned the healthcare industry and revitalized the way we think about patient safety processes. The report also asserted that the problem is not bad people in healthcare, it is good people working within faulty systems that need to be made safer. The entire approach of the Institute of Medicine was to emphasize that error resulting in patient harm was not due to incompetence, bad intentions, or poor work. Instead, they focused on redesigning processes of care to prevent, recognize, and quickly recover from errors so patients are not harmed. As you can see on the slide, although patient safety has been a huge focus in healthcare for over 20 years, deaths from preventable medical errors are still on the rise, according to the Declaration to Advance Patient Safety, published by the Institute for Healthcare Improvement just this year. So what are the ideas behind a just culture? Memorial Hospital of Sweetwater County wants staff to feel supported, safe, and empowered when speaking up about errors, near misses, good catches, and other opportunities for improvement. We want to know about things that will potentially prevent future error or patient harm from occurring. However, because of the traditional healthcare culture to hold caregivers accountable for all errors that happen to patients under their care, people are understandably afraid they will be punished for reporting occurrences. To help us improve processes and prevent patient harm, we need to know about occurrences and good catches when they happen, which means we need you to feel safe reporting these events. In the middle there, you can see the quote by Dr. Leap: "The single greatest impediment to error prevention in the medical industry is that we punish people for making mistakes." And Memorial Hospital of Sweetwater County knows this to be true, which is why we are formalizing the Just Culture process. What a just culture does is acknowledge the reality that humans make mistakes and create an open, fair environment where mistakes and errors do not result in automatic punishment. The idea is to establish a balance between a blameless culture and an accountable culture that supports patient safety improvement. The definition for just culture as it reads in the policy is a value-supported system of accountability that allows individuals to report adverse events, good catches, and hazards in an atmosphere of trust. Just culture is a concept that provides a fair, consistent, and systematic approach when errors are made. A blameless environment is not a reality, so we look to the Just Culture algorithm, which balances a non-punitive learning environment with the need to hold people accountable for their behaviors and actions. The ultimate goal of a just culture is to design safe systems that will reduce the opportunity for human error and capture errors before they reach the patient. Safe systems should help staff make good decisions while making it more difficult for an error to occur. However, it is still up to the individuals to manage their behaviors and choices. What is it we are looking to improve with Just Culture? The first objective in our policy is to simply acknowledge that humans make mistakes, especially in a complex environment such as healthcare. Second, that any errors and risks are reported to patient safety within the Just Culture created by this policy. Our third objective is to get more engagement in the occurrence reporting process. MHSC wants staff to feel safe reporting errors and events, so we provide the Just Culture method. Staff need to know which events are important to report. We have an occurrence reporting policy for guidance on that, and it states any happening that is not consistent with routine operation of the facility. If you ever think, should I put this in Synergy? The answer is yes, please. Feedback and follow-up are critical to a Just Culture, so don't be surprised if you are more involved in the investigation portion of an occurrence report. Part of our Just Culture policy is to not play the blame game or retaliate against staff for submitting a report or being involved in errors. Remember that all occurrence reports are private and confidential and only used for quality process improvements. An accountable culture of safety refers to a shared accountability where the hospital is accountable for systems and processes that are designed, and staff are accountable for their choices and for reporting any errors and system issues. Last on the objectives list, we want to find a balance between the extremes of punishment and blamelessness by applying uniform standards to everyone, and we will take a look at how this happens coming up. We will get to the Just Culture algorithm in a minute, but first let's talk about the 3 categories of behaviors that are looked at within the algorithm. These are reckless behavior, at-risk behavior, and human error. Reckless behavior means a behavioral choice to consciously disregard a substantial and unjustifiable risk. To put it simply, reckless behavior is intentional risk-taking. Reckless behavior is never tolerated in a just culture. At-risk behavior is a behavioral choice that increases risk where there should be little to no risk, or the action taken is mistakenly believed to be justified. Human error is an inadvertent action in doing something other than what should have been done. Errors can be further broken down into slips, lapses, and mistakes. Here is the Just Culture algorithm. When a safety event occurs, this algorithm will be used to assess and objectively analyze the event. This Just Culture method allows for systematic, fair, and objective follow-up or consequences in response to the event. Each item flows into one of the behaviors discussed, and follow-up on that behavior can be discipline, non-punitive coaching, or consoling, depending on what is concluded by following this process. You can see under human error we have console. The person who committed the error should be consoled, and processes, procedures, training, design, or environment should be changed to mitigate future harm. When at-risk behavior is identified, the process is to coach non-punitively by managing the behavior. This could be removing incentives for the at-risk behavior, creating awareness of the situation, or creating incentives for approved behavior. Disciplinary action comes in when a behavior is found to be reckless. Remember, reckless behavior is never tolerated in a just culture. With the reckless behavior, the corrective action policy will be followed. Exceptions in applying this algorithm listed in the policy include HIPAA violations, purposeful, deliberate, or reckless unsafe acts, illegal acts, an act committed under influence of alcohol or other substances, an act committed that involves drug diversion, demonstrated lack of competency, deviation from approved practices without justification, unprofessional conduct, and persistent issues not resolved through performance improvement. Let's go over a couple of quick examples. Case A. A nurse, not wanting to disturb a sleeping patient, does not check a patient's name band and administers an IV antibiotic to the wrong patient. The patient is allergic to this antibiotic and has an anaphylactic reaction. How do we judge the nurse's behavioral choice to not check the name before administering the medication? In a just culture, we want to know, was the job understood? Was the nurse aware of the policy to check name bands? Was it possible to check the name bands? In a substitution test, do all nurses on the unit check name bands before administering medications? Why didn't the nurse check the name band? Did she mistakenly believe it was better not to? If so, why? After investigation, it was revealed that patient experience scores had recently been reviewed at a staff meeting, and sleep interruption was identified as the #1 concern of patients. In addition, other nurses on the unit agreed that they have now awakened patients to check name bands many times. In this case, the behavior was found to be at risk. Now let's look at case B. In 2001, an accident occurred in an interventional MRI room when a piece of equipment flew across the room and attached to the outside of the MRI while a patient was in the tunnel. The event investigation focused on system solutions and staff behavior. The department established safe processes and expectations for staff training and behavior. The staff themselves are screened for MRI safety and follow structured check-in procedures, including wearing pocketless scrubs to minimize the chance that something is forgotten in the pocket. 6 years later, a physician entered the room wearing scrubs with pockets. She disregarded prompts from colleagues to stop, and administration was notified. Following the Just Culture policy, discussion among leaders after the fact focused on how to categorize the behavior as error, at risk, or recklessness to determine how to approach follow-up. Since there were clear policies and behavior expectations implemented and others were able to follow the process, the behavior was found to be reckless. Here are more examples of actions that have gone through the algorithm. Human error includes simple mistakes, slips, and lapses, such as ordering 100 milligrams of medication instead of 10, incorrectly programming a pump because of inadequate resources, and bringing a patient to the wrong department. You can see at-risk behavior involves more than just a mistake. In the examples here, there is deviation from normal standards of practice, such as when a nurse labels a specimen at the nursing station instead of in front of the patient, not checking patient identifiers and writing the wrong name on an x-ray, and bringing a chemical from home to use at work. In the reckless behavior column, you see even more deviation from the norm, providing care while intoxicated, falsifying a signature, not washing hands after being reminded repeatedly, and violating HIPAA were all determined to be reckless behavior. And as mentioned, reckless behavior is not tolerated within a Just Culture. Just Culture isn't just a random concept we want to implement here. It's the foundation for a strong culture of safety. The Just Culture model also aligns perfectly with our mission, vision, and values. Compassionate care for every life we touch. The Just Culture concept shows how we extend compassion and understanding not only to our patients but to our staff as well. To be our community's trusted healthcare leader, we are collaborating with each other to improve the quality of our healthcare and building trust in our community. The values go without saying. Of course, accountability is a huge piece of Just Culture, as well as being kind, respectful, working collaboratively, and embracing excellence. What does all of this mean for you, the employee? Well, we have really been following the Just Culture philosophy for a while, but we have just now implemented a formal process and policy for Just Culture. The Just Culture algorithm should help you feel secure in your actions when entering an occurrence report. Remember, we need occurrence reports to help track and trend events so we can modify any systems and processes that are contributing to error and potential patient harm. Just Culture is all about safety, shared accountability, and learning. Working together for our patients and for one another makes Memorial Hospital of Sweetwater County a great place to be. If you have any questions, you can ask your department director or you can contact me, Valerie Boggs, in the quality department. My email is vboggs@sweetwatermemorial.com or you can call me at 8542. Thank you.